to be here. Thank
Let's
you.
go to our man. Hello, welcome, my heritage. How are you today? I see you smiling, though. Hope you're doing very well.
Yes, I'm good.
Okay.
Thank you. Khalid.
You want to talk back? You came very low. Yes, you can sit up straight. Yeah, I know you let relaxing for sit and shit. Okay. How you doing, man? Welcome to the show.
Thank you.
Okay. But Timothy, I mean, you've been engaged with the whole water and sanitation issue. But where are we now in terms of water and sanitation? Are we on the trajectory to having a clean, affordable water in terms of the watch sector? Is it becoming attractive now?
Well, again, thanks for the invitation. And as you rightly said, the watch sector requires the attention of all Liberians, most especially the national government.
What is the watch?
So WASH is water, sanitation, and hygiene. And over the years, we as government and people, including our development partners, we have been making progress to ensure that everyone everywhere in Liberia receives safe drinking water, sanitation, and hygiene services.
Are we making progress in that direction?
That is a human rights issue, but in terms of progress, there is still many challenges. While we appreciate the little progress being made by the government and partners, but as we speak now, we have, as a country, 98% of resources that is been in the sector that has been supporting the sector come from international partners, which is a very high rate in terms of sustainability of initiatives in the sector. You also have over 40% of our population still practicing open defecation, according to the recent reports from the JMP, the Joint Monitoring Report. You have over 42% of the country population still like defecate in the open. People
And what sort of impact? What sort of impact does it have on our environment?
The impact is that the issue of diseases affecting our people, according to a report from the World Bank somewhere around 2012, it said that we lost over 3,000 persons every year. We also lost 17.5 million United States dollars due to the poor sanitation and poor drinking water condition of our country. There are many diseases that are killing young people that should not kill us in this country. Those diseases could be prevented if only we pay attention to water, sanitation, and hygiene. Look, water is life. And your body contains up to 70% plus water. So when you pollute the water, if you don't take good care of the water, then it becomes problem. So that's why we from civil society and from the partners, we have been working constructively with our government. Right now, as I speak to you, we have the legislature full support. But right now, we have a watch legislative caucus that have been elevated to a WASH standing committee on WASH and environment. That's happened recently under the speakership of Roberta Kufa.
Okay.
Yeah. So these are progress that we are making in the sector. So we actually are making some progress that we can talk about. But on the overall, Liberia still lacking behind. We need to do more if we are to achieve the Sustainable Development Goal 6 that talk about everyone everywhere having access to water by 2030. 2030 is just next door, and we are yet to achieve our country national targets. For example, in the past development agenda, the PAPD, you have 7 high-level targets. In that development agenda, over the period of 6 years, we could not achieve one of those targets in that development.
Let's have this. Let's have
now
this.
We
As
are
a
in the
conversation.
process of having another new development
Let me just
plan
ask
in place.
Let me just ask you. Well, the public consultations are ongoing to derive the national development plan for Liberia, and you have been one of the louder voices calling for the inclusion of watch, in the development plan. Why?
Look,
and what sort of difference will it make
So-
this time around?
thank God that we have a rest agenda that have sanitation as part of the agenda. But again, sanitation is not wash. Wash is water, sanitation, hygiene. So our engagement currently now is to ensure that wash as a sector is clearly highlighted in the new development agenda.
Stay alone.
That yes, it's a standalone sector.
Okay.
And our engagement with the government is to ensure that is clearly highlighted. And when you do that, you will provide opportunity for international partners to invest more into the sector. According to the recent sector reviews that were done, we need over 200 million every year to improve the water, sanitation, hygiene condition of this country. And as a country, if we are just contributing the current funding going to the sector, if we are contributing less than 2%, then there's a trouble somewhere. And that is why we are saying, in order for the government to prioritize the issue of water, sanitation, and hygiene, and not forgetting nutrition, those issues need to be highlighted in the development agenda, and not just highlighted in the development agenda, but the implementation of that component of the development agenda should be something that should be given priority by the government.
Why water sanitation?
That should be demonstrated in the national budget. Over the years, we have national, but even with the current national budget, the 2024 budget, we advocated to have wash included. We advocated to have nutrition included. The vice president promised, that under his office, there will be $1 million allocated for nutrition, for example. As we speak now, we don't know the status of that promise. We don't know whether that money was actually allocated. It's something that we're still investigating. When we fail to improve the wash sector, don't believe that the education sector will improve. When we fail to improve the wash sector, just forget about the agriculture sector, because you cannot do any good. You can improve the education sector without having. How can you have children going to school and they are using bathroom that don't even have water? Can you imagine? They're facing many of the health centers in Monrovia. I'm not talking about the rural parts of the country, but right here in Monrovia, most especially where we are in the flood situation, where partners, including us, are intervening now. You have a lot of unprotected wells that have been polluted by the flood. That's a serious chaos. Now we experiencing the issue with the LWSC PrEP, and although the LWSC is not pumping water all over now, but imagine if the LWSC to stop pumping water, like what's happening now, because they had issue with the PrEP. Where will the people take water from? Are we going to continue to live in a country where people are not given the necessary
Let me
services?
just jump in, Timothy. Why water, sanitation, and hygiene?
Why water? Because you cannot go without water. You cannot go without sanitation in this studio. If you don't have a good bathroom in this place, there will be a chaos. If you don't have a good sanitation services in this place, you won't have the necessary people or the relevant people that are supposed to come here to discuss issue. Even you as a worker, let think about that. So we need to improve the wash sector so that the working environment can improve. The productivity of workers. When you have people getting sick every day because of the poor hygiene condition at the workplaces, what do you expect for them to bring out on the table? What do you expect?
I will get back to you, Timothy.
So that's why, as a country, we need to focus on improving the wash sector. We need to focus on how the nutrition sector is properly handled by the national government, because we need ownership. International partner will not stay in the country forever. Whatever we are doing, if the government don't take ownership, when we talk about wash, then the government will say, "Oh, we got you got plenty international partner." And so what? Right now, as we speak, there is no policy on open defecation. 5 years ago, we drafted a policy to end open defecation in the place. They said nobody should poo-poo osa. That policy is still lying on the desk of the president. The former president says he could not sign onto that policy. Now we having a new government. The policy is still there. We are yet to have that policy signed by the government. And you want for people to improve access to sanitation when there is no policy to guard them. And that's why we are saying we need the government to take ownership. We need the government to prioritize the issue of wash and nutrition, so that the people of this country will benefit from the little amount they are earning from the various workplaces. You cannot spend all of what you have on sicknesses that could be prevented. For example, waterborne diseases that are affecting children, are affecting the women, that are affecting people with disabilities. We need to do more so that we can be on par with other international development agenda, like the Sustainable Development Goals. We need to be on par with other countries that are making headway. 2030 is about to come to an end. What will Liberia report after 30 years? What are we going to report to our partners? What are we going to report to the world? What the world will say about us?
Okay.
How are we going to attract investment into the country? When you have a country that is not clean, a country that is dirty, you don't expect people to come there and invest, because you will not achieve, your investment will not meet its agenda.
Thank you, Timothy. We'll get back to you. Let me go to my heritor.
Attention to this.
My heritor. Welcome. I mean, the flooding situation is on the lip of almost everybody, and you are the focal person on the Food Emergency Response Program. Tell us, what are you involved with?
Thank you for having me. Yeah, we, in connection to that, we are from United Youth.
You want to be more audible, please?
Yeah, from United Youth.
Okay.
And we want to help those that are victimized from this flood. And so we are going to be giving out medical kits. We are going to be giving out non-food items and that of food items. But before then, we had to do this issue where we call the assessment. And in the assessment, we have 20 communities within the Pinsway that we are like anticipating helping.
You are currently doing assessments?
We have done some assessment in about 6 communities.
Okay.
And
why the assessments?
The assessment, you need to do assessment in order to know what is exactly happening. We are hearing that this flood has come, and you are not just going to the community and say, yes, we are here to give you a wazi. You need to do your assessment to see who are those that are really affected. We know people were affected, but I mean people that are most affected are people that we want to help.
What sort of support are you providing to victims of the flooding situation?
As I said earlier, we are intending giving them medical kits, giving them hygiene kits. We are intending giving them non-food items based on
non-food items such as what?
Like we talk about mattresses.
Okay.
Because we noticed that during the assessment, there were a lot of things that were being destroyed. We'll not be there to give them all, but at least we can be able to be of a help in giving mattresses and food items as well.
I mean, this is an initiative of the United Youth. One may be thinking, where did you source the funding?
Well, I will leave that to my boss.
Okay.
To answer that.
Okay, so Timothy, I mean, why this sort of intervention and why this time?
So yes, over the years, as organization, we don't just engage government to do it, but we also support government constructively to ensure that some of the issues that we're facing in this country, they are properly addressed. So as part of our own efforts, when we learned that this flooding was a very serious issue in the country, reported all over the country in many parts of other counties, we quickly intervened by contacting some of our partners that we have, partners that run the Change Fund program. That's a network of local institutions that is a global network that we are part of. And that network has deemed it necessary to provide some sort of support so that we can identify. And we are most interested in the hygiene and the water provision of those who are affected to those who are affected. So we'll be carrying out the distribution of food items, non-food items, hygiene kits that you talk about, hand washing services will be provided. But we actually going to provide safe drinking water to some of those communities that are affected. We're going to be working with the LWSC in communities that they have the water line already. We are going to work with the engineer to do some assessment to see whether we can carry some of those preps, because there are some communities you can deep pump, depending on the ground, the water level and the ground. So you cannot put pump in those communities. So we'll be carrying those preps to do some extensions in the homes of people who are affected. And that will be in collaboration with the water and sewer. In some instances, we will build chaos. and the water kiosks where people will travel for like 10 or 15 minutes from their homes to come and get water from there. And then there are some communities where actually you can provide water services, like hand dug well. We'll be renovating some of the unprotected wells that are, communities that have been polluted. We'll be providing new wells as well. And some of those.
During the assessment, which one of the communities did you see as being mostly affected?
So for the Pinville Bell, like tomorrow, the program will be launched officially in Sise community. Sise community is one of those communities that are actually affected with the flooding issue. You have the So Clinic Bell way in the swamp.
That means you're working primarily in Pinsville, not outside Pinsville. For now, we're starting with Pinville, but we'll go a little bit in Gardnerville and Johnsonville. How many communities are you targeting?
In total, we intend to reach 20 communities, and our direct beneficiaries will include 11,666 individuals that will be reaching personally. And some of them will receive some hygiene kits, some will receive food items, most especially
depending on the needs.
Very good. That's why the assessment you talk about is very key. And that is why we as an organization, we are very much interested to see the government taking leadership in some of those issues. For example, most of the support are coming now for flood victims. Majority of those support come from international partners. Why? Now you have all around the world, they are crisis all over. So partners will not just continue to concentrate on one country. We need to get involved. We need to take ownership. If, for example, when you provide the necessary budgetary support for the wash sector, as we speak now, the wash commissions should have been on the field, the water and sewer should have been doing additional connections of pipes and providing water services to our people. But that is not happening. The budgetary allocation is lacking. And that's why we as civil society, we are engaging the government. We will not get the political will when the issue is not measured in the national development agenda. So there is a critical movement, a critical time where we need to concentrate that 6 years from now, we don't want to come here to this station and say to you that, look, for the past 6 years, we are not able to make any progress. As a country, things are changing every day. So we also need to change. We need to be in line with other developed countries. Other countries are making efforts to develop. We need to follow those trends. So that's why, as civil society organization, we are also intervening. We are also providing necessary support in our capacity. But we can do all. The international partner will not stay here forever. For example, the Water Aid and the other partner that are providing services to our people, they will not stay in the country forever. We need our government to take ownership by putting more money into the budget to address water, sanitation, hygiene, and nutrition issues in the communities. What do we think about water when we are making decisions at the county level? We're working with the we're working with our legislature. There's a WASH caucus and a standing committee, and the intent of that is to ensure that the direct oversight, the proper oversight functions of the legislature is carried out.
Okay.
Recently, we went to So Clinic. You have some abandoned wash facilities, toilet and water facilities in So Clinic in New Georgia estates that
that's one of the things I want to comment. 1 minute to me. One of the things I want to comment, because even in Kakata, and you have some of these very good structures built.
Sure.
But the people are not maximizing it. And what's the attribution? Is it that the people didn't go to them and solicit their view, or they just went in the community and just started building toilets somewhere? So
for our own assessment, we understand that the arrangement with the So Clinic, the New Georgia estate, and the Kakata, those cities that you're talking about, those areas we're talking about, the Africa Development Bank invested over 40 million into those projects.
But the water and sewer corporation, the water and sewer have been used. Why?
That's the situation.
A sanitation issue we're talking about.
Yeah, that's the issue I'll explain to you now. Now, the water and sewer never did the proper arrangement by providing the necessary information to the communities, laying out the required steps to provide those services. That was not done. They went and constructed those facilities in those communities. At the end of the day, they went and lack those facilities.
Are you saying the people were
Those
not involved?
facilities were
Are
not
you
even
saying the
open.
people were not involved?
Community dwellers, for our assessment, they were not involved, and that is why the caucus and the WASH committee chair recently they launched an investigation. And as I speak to you, the issues affecting those facilities were discovered, and renovation work is ongoing as I speak. Some of those what we identified, most especially in the Soul Clinic area, was there were individuals in the Water and Sewer Corporation that went and connected businesses, connected companies, and individuals that could pay, to them and abandon the community. Right on the day of the assessment, the Water and Sewer, the new management, they instructed those on the field to cut off those companies that were connected without the community being served the water that's supposed to go to them. So they were instructed to cut them off, and as we speak now, those services are being renovated. So the renovation are ongoing. Some of those facilities are being reopened, and people are getting water from those services. And that's why the legislature involvement is very key, and that's what we're doing in the country, at the national level. Our people should be aware before development go to them. They should be part of the development process, so that at the end of the day, they will take ownership. That is what matters.
One of your advocacies has always been, making WASH a standing committee at the legislature. Now that has been done, are you seeing any sort of difference so far since that committee was established?
So I just told you that the first intervention of the committee, the standing committee, was to move into Soul Clinic, to move into New Georgia Estate. In the past, you never have a legitimate committee at the legislature to do that. Right now, the House of Representatives putting more emphasis on WASH because there's a committee. Honorable Williams of Maryland, who is the chair, Honorable Goswa of Grand Bassa, who is the co-chair, and the rest of the lawmakers, including the speaker and deputy speaker, they are attaching serious attention to the WASH.
What's the connection, ultimately? What's the connection between water, sanitation, and hygiene, and why are they so interdependent?
So, for example, you cannot provide good sanitation when you don't have water. You cannot get safe drinking water when the hygiene condition of the place is not conducive. For example, you have other water producing companies that are producing in environment that is not even safe. So you don't call those kind of water, you don't call them safe drinking water. Some continue and go to the pump that is well clean and put water inside to carry home to drink. A dirty cup, you put it in the clean bucket with water to drink. I mean, these are things that you can't just do one without the others. So that's why you need to do water, sanitation, and hygiene together in order for you to achieve your needed desire of having safe drinking water. Because you build a toilet, a very decent toilet. When you don't have the water there, that toilet cannot run effectively. When you build a toilet with water in there and you don't have a good hygiene environment, you don't teach the people. Some people, they go to the toilet, they just use it anyhow, they waste water all over. I mean, these are things that we need to keep teaching our people, creating the awareness, so that in the public sector, in the private sector, in the schools, at the community level, in health centers, we need to practice good hygiene behavior in order to live a healthy life.
I mean, what are the biggest challenges, in providing clean water and sanitation in undeveloped country like Liberia?
One of the things that we have identified over the years is the issue of lack of political will. What do we mean by that? You have your policy document that talk about you providing water, sanitation, and hygiene services to your people. And we know very well that when you fail to provide those services, the people will die from waterborne diseases. And those things are just on paper, and you don't have that political will to implement what you put on paper. It's a serious challenge.
You're talking about policy measures?
Policies that are put in place, government fail to implement those policies. As I speak to you, I told you about the open defecation free roadmap that was developed years back, auto presence. It is yet to be endorsed by the government. We're hoping that the new government having catch-up sanitation as key, it's not enough to address those challenges that we face.
But I
We
think
take
that was a right step
serious-
in the right direction. The
That's
fact
why we
that-
appreciated that. That's why we appreciate that. Now is a time that you are in the process of developing a full program or a full strategy for the country. Now is the time that you don't miss that opportunity. As I speak to you, the USAID, the American people are giving 30 million in this country, 30 million United States dollars
for what?
to 5 counties for them to go open defecation free. The government need to pay attention to that resources, how it will be used so that people can benefit at the end of the day. In 5 years, people in those counties, Mosorado, Grand Bassa, Nima, and those 5 big counties should go open defecation free. At the same time, the same American government have put additional 17.9 million to provide safe drinking water in 2 counties. Now, when you have the partner and you have many other international partners, like the Water Aid and the other group, they're coming in with resources into the country to support the sector. When you don't have the ownership of the government, the first thing that will happen, accountability will be an issue. Accountability of the resources will be an issue because the ownership of the government is that strong. And then you need to also have the government putting more efforts in buttressing the international partner efforts by demonstrating political will through the national budget. Let's check in our national budget 2024 and see what is allocated for water and sanitation in this country. It's very, very minimal. For example, you look at the WASH Commission, a commission that should cover the entire country, and you gave them 700,000. Not even $1 million. What do you expect for a whole commission that should cover the entire country with the proper regulatory measures to do 700,000? What is 700,000? When you have countries like America and the other partners coming in with millions of dollars.
Probably that's one of the reasons.
So these are some of the challenges we have. Lack of political leadership in the sector.
One of the reasons that you were saying, maybe, for example, you talk about Water Aid, you talk about USAID, they people bring in the money. So the government feels that, okay, the partners saying those sectors are, kind of donor driven, we would maybe put us some low from there because they will already get some funding from other sources.
And that should not be the case. It shouldn't be donor driven. It shouldn't be donor driven. It should be government owned. As I speak to you, for the WASH Commission to even travel to County 1 to County 2, they will have to ask a partner. Now, the commission is to ensure the proper thing is done by regulating the sector. How will you go regulate, for example, LBS, and you asking LBS to transport you to carry you to the fee? You asking LBS to be able to pay your lodging? You asking LBS to provide you communication? Then you coming back on the fee and say LBS will report the bad things that LBS done in the fee. Why is the rationales behind that? We need to be independent as a government. We know that there's a resource constraint in this country, but also we should not forget.
Don't forget
that there are a lot of resources that the one sector can generate if you really serious to invest into the sector.
I mean, what are the
there's a
sources?
study from the World Bank that when you invest $1 into the water sector, you have the opportunity to get $5 in return. What do we mean by that? You have concession companies in the country that are polluting water all across the country. No one monitoring them. The last time there were issues in Cape Mount, civil society, our institution went there, we did an investigation. It was established that that pollution at the time was done by the company. And whenever you pollute the water according to EPA Act, you have to pay fine to the community. Who is ensuring that those resources are collected? The beer factory, for example, all of the water they are using, the cocoa factory, all of those companies that are taking our water and making money out of it, what are they giving back in return to our country? The WASH Commission, there's a provision in the Act of the WASH Commission that talk about revenue generation. My brother, you have more resources to generate from the WASH sector if you put more time and effort into that.
How does
that is why it should be number one priority of this new government, because when you do that, your agenda to achieve the road agenda will be successful, because the workers that are going on the roads, the workers that are being using the machine to go and grade on the road and give you the best of roads, they will not be getting sick every day. They will live a good and healthy life that will enable them, the workforce, to be very effective and deliver on the rest agenda that we are talking about today.
Okay.
Don't take water for joke if you want to achieve your development agenda. Thank you.
Great. This is the Bomba Show. Timothy Ekpe is the executive director for the United Youth and the focal person for sanitation and water for all. We have Madam Henrietta and Jimin, the focal person for the Food Emergency Response Program. This is where you get the very best of information. Let me go back to Timothy. I mean, how does lack of clean water and proper sanitation impact communities?
So when you don't have safe drinking water, almost every day the sickness rate in the community, most especially for young children, will increase. You just do your own statistics. Visit communities where you have limited water as compared to community where you improve water, and visit those clinics and those hospitals and see the attendance of sick people. Now, that go to the education sector. There are times, most especially for the female students, there are times where they need more water, and when the water is not available in those schools, they will have to stay out of school. And what that means is that you are affecting the education of females. For the boys, they will easily use the bush, to ease themselves, but you don't do that. Those girls can do that. It's just difficult. And don't forget to know that even most of our girls have been raped according to other statistics and study, because they have to travel far or in the forest or in the bush to use the bridge to ease themselves or to collect water. These are cases that are happening around us. Now, when it is not happening to you, then you feel that nothing happening. But most of our young people are being abused because they are in search of water. Now, for during a dry season, for example, go to a community that have only one handpump and see the number of children that will be on the line waiting to get water. Many of them will go to school late, and most of the school, we don't care whether all they know when the time reach, they close their gates. And the children will have to go back. Some of them are afraid.
So it means it has so many impact. Different sectors.
Are afraid to go back home when they lack the school gate because of water. They will either go and stay with their friends the whole day and wait for the school closing hours. At the end of the day, you will find out that parents will spend money for their children thinking that they're going to school, but rather they are being denied education because of the lack of water. So there are a lot of implications that we all need to consider and take very seriously. It affects the education of our children. It affects the young people, most especially children under age 5. The high rate of sickness and diseases in those communities. It affects those children's growth. And we talk about nutrition. When you don't have a good water, good sanitation, good hygiene, you can't have a good nutrition for young people. Go visit the hospital. People are giving birth without safe drinking water. You carry your pregnant a wife or a woman or whoever to the hospital. You have to, in other parts of the country, you have to, you as the guardians or whoever, you will leave that pregnant woman in the hospital and go draw water out on the creek to bring it before that woman can give birth. Can you imagine?
I mean, beside the issue of political will, Timothy, I mean, what can be done, to improve access to clean, sanitation and hygiene in our communities?
So
I know the political will is there, but what can be done?
In addition to the government ownership of this sector, we also need community ownership.
Okay.
And what do we mean by that? You have services that have been provided in some of those communities, and community dwellers turn them as government property. You have donors, NGO making efforts to provide hand pumps that a community will cry for years. When that hand pump comes to the community, the woman will say,
maintenance is an issue.
The woman will say that government property there.
That's maintenance.
The community chairman will say that government property. So when something spoils on that pump, no one cares to pay attention. So there's according to the guidelines of the wash sector, before you build a hand pump, you should have wash committee. Wash committee, there are people who are trained. When something happens to the pump, they will repair it. But in most of those communities, those people are trained. By the time they do not leave the community, the committee become a dare committee.
Because the reason I ask the question is, sometimes in some communities you see hand pumps. Maybe they say every month you pay like maybe $100, and it becomes a controversial issue because some people will not want to pay, and other people sometimes you see noise all over the place. So the issue of maintenance too is key because you are just saying some of the toilet facilities that were being built by the donors, they not being used, even though the community said they were not consulted, blah blah blah. But the fact is, it is meant for their usage. They're not making use of it.
And that's the awareness we and other partners, including other civil society, are providing over the years. Now you should take charge of whatever services that you receive in your community. You have to pay for those services because that's a simple machine. After some time, it will get problem, it will develop problem. And some of the problem with the hemp pump is just called there's something they call UC. That one quit to spoil on the pump.
Yes.
When that one spoil, you just spend $5 or you spend $10. Some of our partners that the water aid, they are trying to carry the spare parts because some of the communities say, oh, but the thing spoiled, we don't know where to find it. But for example, in Tori, water aid intervention in Tori, they are carrying spare parts closer to the people. So those businesses that are already running in the rural communities, the partnership with them, and those people now put the parts of the pump that quite to spoil, they buy it and put it in their shop. So that when the communities have similar problem, they just run to the shop. They see where you can buy the rest there. You see where you buy all. You can just go and buy the UC and buy the other materials. These are some of the means that we're doing to ensure that community take ownership. But if we fail to take ownership, let's take, for example, right? You got a hospital.
Mm-hmm.
You ask international partner or even the government to come and pour in the hospital. They pour in the clinic there and grass cover it in the clinic. They pour in the clinic and something spot on it. You can't face it. You're waiting for government. How do you expect for you to live a healthy life, for your environment to improve when you not take ownership of some of those things that come to you?
Sure.
So our advocacy also not just looking at the government.
The government,
we're looking at the community dwellers. What is our role? How are we taking this initiative as our own? And not just time will come in this world that donor will say, we tired of supporting Liberia. Before you have a group called Oxfam. Oxfam were in the country, they were all over building pumps. Where are they today? They are no more. So if those services provided by Oxfam were not meeting those communities, I will speed down, they're going back to open defecation, they are going back to lack of safe drinking water. So we need to take ownership in addition to the government. And while this thing is also tied down to the government, when you talk about the local government role and responsibility,
it's key.
You have the town chiefs, you have the village chiefs at the county level, but they are not monitoring and not saying. When you call your town meeting, you don't even measure anything about the water and the sanitation situation in your communities. How will you ensure that people take ownership? So these are things that we continue to engage with our people. We continue to engage the national government and also engage our international partners, that we all need to work together to ensure that the issue of water, sanitation, and hygiene is given serious attention. If the arrest agenda will not address sanitation, water, and hygiene, including nutrition, we still doubting what kind of agenda that we can again before we can address that. So now it's a time. Now it's a time that you have a government that have come with the agenda with sanitation catcher. We can hang on to that sanitation and ensure that water is included, the nutrition is included, and hygiene is included. And that's what we are on. And there is a right time to do so because the agenda for the next 6 years is in process. As we speak, the government currently at the county level, there are consultation ongoing. People in Bapolu, in Riverside, in Grand Gita, they are listening to the show. When the people come to you and you don't mention water, sanitation, and hygiene, when you talk about road, you talk about Palaba house that don't even have a hand pump or don't have a well, then you're not doing anything good for yourself. If you are to mention cleanliness in your development priorities, if you are to mention school, make sure that those facilities that are going to be provided capture water, sanitation, and hygiene as key component. That's the only way you will realize the development.
Wonderful. This is the Bumper Show. Of course, my name is Emmanuel Colley. We'll begin taking your calls up to 4:55, and then we'll come back to our guests. We can try to wrap up. Yeah, they into this advocacy to ensuring that water, sanitation, and hygiene, it is prioritized in the government development plan for Liberia. My name is Emmanuel Colley. Let's begin taking your calls. Maybe you want to ask, you want to make a comment, you want to contribute to the conversation. 0770-567-7764, 0770-567-7764. Timothy Bear is the Executive Director for United Youth and the focal person for Sanitation and Water for All. We have Madam Herita and Jimmy, the focal person for the Food Emergency Response Program. 0770-567-7764. This is the Bumper Show, and I want to say good afternoon to Mrs. Cyril Riches Graceway of the SKD Sports Complex community here in Pinsville. Today it is your birthday. It comes from your daddy husband, Mr. Jennington Graceway, here at LBS. 0770-567-7764. Timothy Pay is my guest, and we are talking about water and sanitation. Wherever you are, whatever you're doing, be a part of the conversation. While we are waiting to call Timothy, I know we're not talking politics. So yeah, but the issue of ensuring that the government and policy makers, let me talk to this person. Good afternoon. Welcome to the Bumper Show. Please leave from the noise.
Good afternoon. Is this ELBC?
You're live. Go ahead.
Okay. Good afternoon once again to your video guest, Mr. Fair. Thank you very much. These are things I would like to hear when it comes in the land, water and sanitation. It's the key, like he was saying. Even the common land that we live in, even the common land that we live in, before that can begin, water play an important role in the establishment of human existence. And, one of the challenges that I see within this city, like you were rightly saying, is maintenance process. And sometimes the maintenance process, anything that has the mention of government name, I don't know why we don't take it very serious in this particular country, more especially in this central Morovia. To give you a short scenario, I visited Lofa this today, and I saw a handphone was constructed by Consent International as far as 2014. Just imagine the way the people in the interior are taking that handphone as if to say it is a personal thing, I can say. What do I mean by this? I mean, this law is very strong. Before you even enter that place, you didn't even enter there with hair open. Neither to enter there with paper, neither to do things that is not right. You will be punished.
Okay.
So you see in this particular city, you see people do things, more especially those ponds that have been constructed around here. You see kind of filthiness and other things, people carrying all kind of things there to do.
Okay. Thank you.
I'm seeing waterborne diseases taking place within this particular city, especially during release time.
Thank you. Let me talk to this person. Good evening.
Good evening.
Welcome to the show.
Yes, I'm Lamine Esquana from Bon Country.
Are you in Banga or somewhere around Swakuku or in Belinta?
I'm in Banga, Ganta Highway.
Great to have you, man. We're discussing water, sanitation, and hygiene. What's your contribution?
Seriously, it's very, very serious in Liberia here.
Okay.
It's very, very serious. Up in Curia area, we just looking like animals. We sometimes there is no toilet in the town. Whenever the water is running, we use it as toilet. There were a company here that used to help people to build toilet. They were educating people a year back. But when that company left, my people is very hard. I'm not talking about Monrovia where there are people over there, they poo-poo, they put it under the bed in the night, they have to chunk it around. It is serious for this government to enforce this law. People must go around up, even the various villages. People that live in Monrovia, they are human beings. People that live way in Propa, they are human beings. You see?
Okay.
So it is important. It is very, very serious what that brother is saying to the video, that government take it to be serious. It should be one of the arrests. And it should be very much taken serious. We are killing one another here. I'm not lying to you.
Thank you.
And Ronnie,
Thank you. Thank you.
5, 6, 7 people in that water to drink it.
Thank you
I've
so
seen it
much.
here.
Thank you.
Thank you,
Thank
ma'am.
you. Thank you so much from Bon County. Hello, welcome to the Bombo Show.
Hello, how you doing?
Yeah, we okay. Go ahead, make your input.
My name is Daniel F. Colley and I call for Central Monrovia.
Mr. Colley, it's always a pleasure having you. Go ahead and make your input.
The brother is here there. What he's saying about sanitation, water and sanitation is very, very important to the arrest agenda.
Okay.
The government have to be serious to take this water and sanitation issue as part of the arrest agenda. I can remember back 2014, I went with global community in the interior, somewhere around the Bapun area, where we help the community dwellers to build their own toilet. But if you go there now, the people are going back to the bushes, the toilet thing. I see. So now the men go in the bush and toilet and say, leave them, please, say, if people are happy to go and leave. Well, I mean, go in the town and take the cola and divide the cola into two and give it to his friend to eat. Well, I mean, what is that friend eating? A complete toilet. So you see, the arrest agenda is supposed to be part of the water and sanitation. It's very important.
Thank you. Thank you so much.
Thank you again. One more.
Yeah, okay. Thank you. Thank you so much. Thank you. This is the Bomba Show. Of course, my name is Emmanuel Colley. We have Timothy Pair. We have roughly 4 minutes to go. I will take just one more call and then we will go back to our guests today on the show if we were to. My phone has started freezing and all. Okay, so I mean we can just stop. I mean the calls are busting. But Mr. Pair, I mean everybody is saying the same thing, and I know this is a campaign you've been on for years now. I hope that one day you will make this as an achievement.
Oh yes, and that's why I mean we listen to the caller. Almost everyone everywhere. The issue of safe drinking water is something that we all need to take very seriously. Like somebody said, you live in a town where the upstream that somebody on a washing area and they wash their clothes and other things, the baby dabbers, they wash all that up the stream, and then you living down the stream and you use the same water as a drinking water. And you know that these are some of the scenarios that that we need to reference. You talk about some of the areas where animals die in the bush and that animal fall in the water, and you don't know. You live downstream and you just drinking water. All you know is that you're drinking water, safe drinking water for you. But these are things that continually affect us as people. You know, so that's why we have come as civil society organization to bring this to the attention of the government. You cannot take a life-saving situation and you place it on another sector. Now, putting water, sanitation, hygiene on energy is not going to serve for anything better. We that need to stay alone. You have a standing committee now that is responsible to provide direct oversight of over the one sector.
Wonderful.
So why should you place that on another sector as a short sector? I mean, the thing that killing people in the country, we need to pay attention to that. Great. And when we pay attention as a people, as a government,
let me go to my progress. Jimmy, let me get your parting comment on the whole floor and emergency response thing, you know, as your parting comment.
Okay, thank you. One parting comment will be like tomorrow in the sister community.
Okay.
We are going to be doing the launching, and then we are like inviting other communities that have been assessed already concerning this flood issue, that they will all come and be part of what we are doing tomorrow. And as my boss rightly said, we have this direct beneficiary. We have about 11,666 that we are targeting, yeah. And most especially when it comes to children, women, and people with disabilities. And so we are looking up to people tomorrow, and we are working along with the National Disaster and Management Agency, and we are expecting them to be there as well.
Thank you. Timothy, in 1 minute, let me get your parting comment. You say almost everything.
In 1 minute, if we are serious to achieve a rest agenda and whatever agenda in the future as a country, we should consider watch number one in that agenda. It shouldn't be a short sector. It is a sector that should stand by itself. It should be captured in the national budget as a sector that we have a standing committee that providing direct oversight. That is key, because when you improve the water sector, the education sector will benefit, the health sector will benefit, the agriculture sector will benefit, and the most about the role agenda for this new government will be achieved, because you will have a good workforce that will enforce whatever work that should happen. You will have young people, healthy people going to school every day. Most especially our girls will continue to remain in school. So let us consider wash and nutrition in this national development agenda that is still in the process. Let all our stakeholders pay attention so that wash can be prioritized on the arrest agenda. Thank you for the opportunity. Thanks to our quarter.
Thank you. Thank you. That's the voice of Timothy Clare. He is the Executive Director for United Youth and the focal person for Water and Sanitation for All. We will take a break and we'll come back. We invite our next guest, Representative Jeremiah Sokan, District 1 Representative, Grant Jida County. Let's take this. Okay.
Chop my money.